Millions of people turn to injections to restore their youth by smoothing wrinkles and age lines on the face. Products like Botox and Juvederm are known to take years off your appearance.
Today we welcome Dr. Matt Jones. He's with Jon Ric Medical Spa and Wellness Center. Good morning, Dr. Matt. How are you?
I'm just fine, ladies. Thanks for having me again.
Thank you for being here. Okay, so we're talking about really minimally invasive procedures that a lot of people use. Let's start with Botox. Exactly. I think most people have heard of it by now,
Right.
but what is it?
So Botox is a minimally invasive procedure. It's an injection of a purified protein that actually goes into the muscle that we inject it into. It blocks the signal that your brain is sending, telling that muscle to contract. It helps block the dynamic wrinkles that are caused by muscular contraction. So we use it on the face to help prevent wrinkles.
Okay, so what areas on the face can you treat with Botox?
Sure, we can treat many areas on the face. Botox itself is FDA approved for the glabellum, which is the area between your nose here, or your 11s as some people refer to them, and your crow's feet. It's also used on the forehead. It can be used for strong frown lines. It can be used for lines on the lip. It can be used for overactive chin muscles, platysmal bands. It even can be used in armpits for excessive sweating.
How many treatments does a patient need? I mean, I know it lasts, if you're treated with Botox, it usually lasts about 4 months, 4 to 6
Correct.
months, something like that?
Yeah, so we can do as many treatments as a patient would like, or if they need. You can always do touch-ups, but the idea is that one treatment lasts anywhere from 3 to 4 months, depending on the areas you're treating and the person you're treating and the volume you use.
Okay, well, so I decided to go give it a whirl.
And I think it looks good.
So I went to see Dr. Jones in his office at Jon Ric. It's beautiful over in the Park Road Shopping Center. Lovely office, by the way.
Thank you very much,
Dr. Jones. And I met with you and we had a consult. I talked about the areas that I wanted treated because I noticed on TV sometimes I looked a little bit angry when I didn't feel angry at all. So again, there you are. That's how it's performed, correct?
Correct. This is a very typical procedure. We do a thorough consultation. We discuss with the client. I discuss with the client what it is they're looking for, what they're trying to get, because not everybody wants the same results. Not everybody wants to, some people still want to have motion. They still obviously want to have expression. I want to make it clear that Botox is not going to freeze your face. Your husband or wife is not going to be able to not be able to tell when you're angry,
right.
But it just won't look that way when you're not actually
He
angry.
He still knows when I'm mad. I want to show you a before picture of what Dr. Jones was calling the 11s, the area there right between the eyebrows.
Correct. Yeah, this is what we refer to as the glabellum in the medical world. It's your 11s or your frown lines. And we treated Colleen here. And you can see she's actually trying to be mad at me.
I'm so
and
mad.
It's just not working because she's so happy with her results.
What you talking about? What you talking about?
Isn't that amazing? It's gone. And I found if I made the slightest movement in my face, I'd get those lines.
That's
and
right.
It made me look angry when I wasn't, and it kind of bothered me on TV. Next, the lines in the forehead. A little bit Shar-Pei looking here.
Correct. Yeah, I think most of us have that Shar-Pei look. It's what we try and prevent with Botox is those lines setting in permanently. And as you can see, you have many lines there now. When you raise your eyebrows,
I'm raising my eyebrows. Yeah.
They're already up. Go ahead and lower them and raise them. Shows people that you can actually still move your eyebrows, right?
Yep.
So you can still look surprised. That's okay. We just don't have to wrinkle up your entire forehead for it to happen.
Very good. You mentioned the crow's feet.
Exactly.
That's another area. Again, here's the before picture of my crow's feet, the little lines around the eyes when I squint.
And you can see, Colleen's a very beautiful woman, but she does have some crow's feet. And now that we've done her treatment, you can see how reduced they are there. Now, the lines underneath the eyes that you still can see, those are more a reaction of your cheek raising up with a smile. Those aren't things that we can treat necessarily with Botox, but you can see the lines that you do have were well treated. And I think you have an amazing result.
I'm very happy with it. Thank you so
Great.
much. Quickly tell everybody
you.
what sets your facility apart from others.
Well, as a Jon Ric facility, as a physician there, as the owner and operator, I am the only person that's going to be doing your injections, whether it's Botox, whether it's Juvederm. We don't have nurse injectors. We don't have physician extenders doing those injections or those consultations. It will always be me. And I think that that's a huge plus, and it certainly would be what I would look for if I was sending family members to the doctor.
It made me very comfortable.
And very quickly, what does the Juvederm do?
So the Juvederm is a dermal filler. It's made up of hyaluronic acid, which your skin naturally has in its youthful, healthy form, and as we age, it decreases. So that's some of the thinning of your skin, the hollows that you get, and the deep-set, non-dynamic, or what we call static wrinkles that you get around your mouth and along the sides of your mouth, underneath your eyes, can also be filled out using this filler. It just replaces your natural hyaluronic acid, and it fills in the heavier, deep-set lines like you can see in these ladies on the before and after pictures here.
Looks so good, so good. Thank you. So I can't thank you enough. I'm very happy with my results. Thank you so much, Dr.
I'm so
Jones.
happy that you're happy.
You made it very easy for me.
And she looks happy.
She does.
I don't look angry. Charlotte Today viewers can receive a free consultation with Dr. Jones by calling 704-665-0058. Again, 704-665-0058. If you mention Charlotte Today, you'll receive 20% off your first treatment. Again, the phone number is 704-665-0058. And you can also learn more by visiting JonRicCharlotteMedicalSpa.com. JonRicCharlotteMedicalSpa.com. Dr. Jones, thank you so much.
Thank you so much.
Really, thank you.